Hi everyone, Jeremy and David from Phoenix International Stem Cell Clinic. So today we're going to discuss a little bit more about what I do. David?
So here at our clinic, as you know, we offer musculoskeletal treatments for patients with joint and back pain. In particular, we often talk about stem cell treatments, and that includes the regenerative medical side of things, where we do both PRP, stem cell injections, and we're working on exosomes. We're going to be trying to do those shortly. And as we've talked about before, these are processes that call up a regeneration of the tissues. So the body, actually, we're using cells, we're injecting them in, and we're trying to let the body heal itself by increasing the amount of tissue and the volume of tissue available in these joints. Mm-hmm. What we haven't talked about until now is how this synergy works, how the medical side, the regenerative side, and the chiropractic or the physical side really mate so well together. And we feel like in our clinic we are unique, and we are certainly unique within Europe. We actually think we're unique worldwide. As far as we know, there are very few, if any, other clinics offering these treatments in combination. And today we're going to talk to you a little bit about why does a chiropractor manipulating a joint help, how does that work, and what can it do. So from the very outset, we have a prop with us here. We have a knee. Here we go.
So for today we're going to talk about knee, because we do so many knees, and we talk often about patients that come in. And just the other day we had a patient that he was midway through his treatment protocol. He'd had his stem cell in transplantation, had good growth of new tissue, but the problem was he was still restricted in movement. Mm-hmm. So
and that means that the patient comes in, he's limping, and he gets himself onto the bench. We start to talk, say, "How are you?" "I'm okay, I'm definitely better, I have less pain. But my knee isn't working properly." And of course, being a doctor, I'm like, "Oh, tell me more." And we go into the background of why it's not working. And he explains that he feels that his knee was actually nearly worse now. And I was like, "Well, what do you mean worse?" "No, it's not bending as much as it used to." So the immediate best response, if you ask me, is call in the biomechanical expert. I called Jeremy in to get a look at the patient to see if there was any reason for this, because as far as we're concerned, our treatments make people better. They should never make people worse. So Jeremy came in.
And so that was the thing. He could barely bend his knee at that time. And what's great is by the time he walked out, he had over 80% of the movement back in his knee. And so what typically happens with arthritic knees, this is an 80-20 rule. So about 80% of the time, there's two things are the things that happen, okay? Of course, there's other things that happen, but let's just talk about the majority of cases. So typically we see in knees, okay, we can do shoulders, we can do spines, we can do everything else later, but in knees, we see that oftentimes as it's degenerated, a lot of the times the medial side, that's the inside of the knee, is that it degenerates first. So what you tend to do is, instead of having a knee that moves like this, two things typically happen. One, that the tibia, which is this bone at the bottom, like your shin bone, starts to twist backwards, okay? Or, conversely, the femur, which is that thigh bone, that will actually go out, okay? So it can either go in this way or out this way, okay? And so what that then means, instead of that joint moving like this, it'll move like this. And as you can see, it means that you start to grind the surfaces different. Now, what's happened with pretty much all of our patients that have come in with this type of, with degenerative changes, is over time, their joints had changed, so they use their joints incorrectly. So what happens is, if we have a patient who's got a twisted knee, or not so much twist, it's just not functioning as it should do because it's used to moving this way, it's just like a bad habit, and we grow new tissue in there, but that knee hasn't corrected the biomechanics, you actually find that the problem can get a little bit worse because he's got less space to move, so things become a lot tighter. So typically, David still asks me how we know which one's what. So typically we say that the tibia, and that's that shin bone, has rotated inwards when the patient has lots of problems to flex the knee. That's to go backwards. And if you can see, that's because when we do this, we make a little bit of an outpouching here, and it means that we get a pinching sensation into that meniscus in here, okay? So we typically say that the tibia has rotated when people have problems flexing, okay? And the other thing they have is when the tibia, the femur, which is that thigh bone, when that rotates externally, which means outwards, typically that again can give a pain both sides, but the patient typically feels it most when they're trying to extend. That means they're trying to flatten or straighten out their knee. they start going, oh, I can bend it, but I just can't straighten it out. And that typically is when the femur or the thigh bone is rotated. Now, of course, that's sort of to give you what we call static. So it's not that this bone is completely twisted and that's twisted. It's more that the function has indicated that. So what I can do as a chiropractor is I'm able to actually traction a joint out, and I'm able to correct those biomechanics. Now, not only does it help in a localized aspect, so it not only releases and stretches out the tissue so that then it can start to move properly again, but also you have a more global effect. So while I might stimulate the tissue here, I've also stimulated a lot of the nerve endings that live inside the joint called proprioceptors and also mechanoreceptors, and they're the ones that send signals up into the brain. So what then happens is we've stimulated locally for the tissue to have more stretch, but also we've stimulated up in the patient's brain and actually woken up that brain to say, hey, we're not using this joint correctly, we need to start using a different way. Again, it's really important to note that it's sort of like creating a new habit. So typically one off is not enough. You need to do it over a few times. Think about if you are planning to learn the violin, one lesson isn't enough. You tend to need a few. And that's exactly what happens with this joint manipulation. But it can really help to take those patients from having, in a way, too much of a good thing, as in too much tissue and not enough movement, that we're able to correct those motion patterns straight away, so the patient can walk out the same day being able to load the joint. Mm-hmm. And that's extremely important. The more we can get our patients using their joints normally, the more that stimulates the biological factors that we've put in, stem cells or PRP, to stimulate more growth. So we really want them to be moving.
That's right. And just to round off the story, that the patient we're talking about, so I actually had to run out and see another patient. I came back out of the office, and on my way past, the patient walked past, not limping and no longer in pain. I said, are you okay? I'm so much better. And it was kind of an eye-opener for me, seeing this patient who came in and was kind of not where I expected him to be. No. And after a simple treatment, was actually able to use his knee better than before he received the procedure, which is what we had expected in the beginning.
Exactly. It's amazing how just little things can make an enormous difference when you sort of combine them. Yeah,
and that's then, Jeremy has kind of hinted at this. I just want to really put the underline here and say that, not only does this give people what we would call a microscopic, the big picture effect on the muscles, the local muscles of the thigh and the shin, and help the thing sit in the right way and help the brain to learn a new pattern of movement, or to relearn the pattern of movement they should have, I suppose we should say. This also helps the cells themselves on the microscopic level to grow better. And that has been evidenced by our friend Dr. Bansal in India, who was actually researching a method of growing these stem cells in the lab. Not something we do in the EU because it's not legal to do so here, but in India they were researching this, and they struggled to get mesenchymal stem cells to differentiate into chondrocytes, that's to say cartilage cells. And they discovered that if you put stem cells into a petri dish and you let them sit, you have to have the perfect environment. Those cells will actually grow into fat cells if they have too much resources and too much rest, which you don't want in a joint, of course. So they discovered that the way to get this to happen is to stimulate the cells with low oxygen levels, which is what we have in a joint, and mechanical stimulation. And of course, there is no better stimulation than moving the joint the way it was supposed to be. And as we get our patients trained with the physical side, the biomechanical side, following up the regenerative, we're seeing people get real leaps and bound improvements, really, really impressive improvements, because not only are they stimulating the joint by this new injection, by the techniques they're given, but when they come in, they receive their treatment with the chiropractor, and then they're given some exercises to do, we're really seeing improvement, and it seems to make such a difference. So I'm very proud and really pleased to be part of this clinic where we have such a good synergy. And I have to say that we reckon that we are one of the world's first clinics to have such a focus on the mechanical stimulation after a treatment like this.
Yeah, that's exactly right. And not only with knees, but with shoulders and lower backs. That's something we're going to go in later. But that's enough for us for today. We hope you guys enjoyed it. If you've got any questions or comments, please write them down below. And otherwise, we can't wait to talk to you guys next time, okay? Have a great day. Bye. Bye.